So let's start. This was a 47-year-old woman. She came into us with a palpable lump. And we see that we got a CC, a craniocaudal, and our lateral medial, lateral oblique view. And we have this BB over where the patient feels the lump. And in this case, at kind of the edge of the mammogram, we're seeing this high density irregular mass. And so whenever we see a finding such as this, or a patient feels something concerning in their breast, after the mammogram, we're always going to proceed with an ultrasound. So here we went on to this ultrasound of that spot on the mammogram and the area that the patient was feeling, and corresponding to her palpable lump and that finding on the mammogram, here on her ultrasound, we see this corresponding hypoechoic irregular mass with angular margin. So ultrasound helps us make the diagnosis that this is in fact not a cyst, it is a suspicious solid mass. And then she underwent ultrasound-guided core biopsy of this mass. So ultrasound is very key in breast imaging for both diagnosis and to enable us to do tissue sampling of suspicious breast lesions. And so the message of my talk today truly is that breast ultrasound is central to the diagnosis and sampling of breast lesions, and optimizing your technique will help you make the right diagnosis. So the goals of my lecture today are going to be reviewing the BI-RADS for breast ultrasound with a focus on the most recent updates. In 2013, the second edition for ultrasound BI-RADS was published. This was along with the fifth edition for mammography and the second edition for MRI. And today we're really going to focus on breast ultrasound, and we're going to start by reviewing things such as breast ultrasound anatomy, technique and image quality, and then we're going to focus on how to report and things to look for when you're performing a breast ultrasound. So the first module today is going to be a review of anatomy on breast ultrasound. In our new BI-RADS manual, there's two subsections related to breast anatomy. The first has to do with technical issues, and they state that on your breast ultrasound, you must image to the chest wall to assure visualization of the entire breast. They updated this because when people were submitting ultrasound images for ACR accreditation, they realized that a lot of practices weren't showing deep enough in the breast. So you want to make sure in your ultrasound images that you're showing down to the chest wall, and we're going to review that in detail in the upcoming part of this lecture. There's also this new section related to tissue composition, and this is analogous to how we report breast density on mammography or BPE on MRI, or composition on MRI. And so they state that in a screening ultrasound, so if your group or your practice is doing screening breast ultrasound, you should state the tissue composition, and we're going to look at examples of these, but this can be homogeneous fat, homogeneous fibroglandular, or a heterogeneous tissue composition.